Hello everybody, once again, what a surprise, I'm starting a video looking a little bit ratty. So today's video is going to be all about my most recent course of IV antibiotics, why I went on them, what they are, also all about my PICC line which I went up to get inserted and also then had to take out at home. We'll get on to all of that. My last course of IV antibiotics was in July of 2020 and usually the course lasts for 2 weeks and I was planning to do a video all about it back then, but if you were following me over on my Instagram you will have seen that I was only on my IV antibiotics last time for a grand total of 3 days, which was not ideal, but there we are. I had lots of trouble with side effects. That just seems to be the general thing now. If I go on anything, my body just likes to kick up a fuss. Very frustrating, but that's just how it goes. So this time round on IVs, I was just really hoping that I could do the full 2-week course. Spoiler alert, that didn't happen, but it still went better than... I was going to say it went better than last time. I don't really think it did, but anyway, you'll see. If you don't already follow me on my Instagram, then please consider checking me out over there. It's a great way to keep up to date with me and also take part in videos when I do more interactive content. Also, don't forget to like and subscribe and stick around for more videos like this in the future. Anyway, I shall get into it. So as I mentioned, the last time I did have IVs was back in July of 2020. The kind of standard thing for most people with CF is that when you get a chest infection and a cough that is particularly bad, usually the first way to treat it is oral antibiotics, so tablets, but then if after that your cough is still pretty bad, it's quite likely that the doctors will suggest to go on IVs. IV means intravenous, which means through your vein. So when we talk about going on IVs, this is what we mean. We mean going on strong antibiotics, which are essentially like a drip. It's going through an access point in your veins. This could be something like a PICC line or a long line. Another example, a way you could give IVs is a cannula, which a lot of people will know because they might have had it. Of all of the options of lines to go in my arm, PICC line just tends to work the best for me. Long lines really don't agree. My arm a lot of the time will come up in a rash. A PICC line goes in through a point in your arm and then will go round to a big vein at the top of your heart. So it just means that it's strong and it will last longer because it's going into a chunkier vein. But the reason that I wanted to go on IVs, well, I didn't want to go on IVs, but symptomatically I was coughing a lot. I really wasn't feeling myself. I was coughing a lot at night, was having a lot of chest pain and achiness, which I do get sometimes, but not consistently. So that's why I thought it was really important to go on IVs. So I was really urging my doctors. I haven't had a 2-week course now in nearly a few years. As I mentioned, the July 2020 course was only 3 days, so it's not very long. So I kind of wanted a proper blast of IVs. So I'll pass over to my past self who is explaining all of that. Hello everybody. Oh my goodness. Wow. Hello everybody. Tomorrow I am going up to the hospital to have a PICC line fitted to start a 2-week course of IVs, and I don't know how conscious and functioning I'll be in the morning, so I might not vlog. But yeah, I'm going up to London on my own. I haven't travelled literally anywhere on my own, let alone on a train, in like a year and a half now, something like ridiculous. We love shielding, so I'm a little bit nervous, but I'm also kind of excited because I feel like in terms of social anxiety it's gonna work wonders for the confidence. I'm gonna go up, hopefully all's gonna be fine. I'm gonna be like, yeah, I can do this, this is fine. But basically I've had a chest infection that's been knocking around for a while. I think probably since like September. It's been quite a while that I've had something there and it hasn't really been going away, so I just need a blast of something stronger. And yeah, and hopefully at the end of this 2-week course everything will be hunky-dory again. I mean, that would be great. Good morning, today is the day. I didn't want to film when I first woke up because I did not want to subject you to my morning face because it was rough this morning. But I'm all ready to go. We're gonna leave in about 20 minutes. I'm breaking it, I'm not gonna lie. I'm just worried about travelling by myself. I'm worried the PICC line's really gonna hurt. I really wanted to wear a white top underneath this jumper, but I didn't want to risk blood just going all over it, because that sometimes happens after you put your PICC line in. You just bleed everywhere. But anyway, it's a lovely sunny day. I'll probably, if there's time, maybe do some shopping after. We'll see. here I have set up ship, as it were. I'm still feeling really nervous, I'm not gonna lie. I'm just worried it's gonna hurt. The last time I had one put in, the guy who does it is an absolute sweetie. He's so gentle and so good at it, but it still really hurt. So I'm just kind of worried that it's really gonna hurt again. And because I'm on my own, I feel like an adult. The worst bit is definitely always the bit before, like when you're waiting for them to come in and do whatever they need to do. And that's the bit now, and that's why I'm like, oh. Once it's in, once it's all done, once I know everything's sorted, I'll feel like chilled and fine. It's currently 1:15. I have no idea how long I'm gonna have to wait until my PICC gets put in, but I thought I should probably do a before and after. So here's my lovely arm before. It's all clean, nothing in it yet, no blood everywhere yet.
The line. The idea is to remove all the air in the line. When your medication is ready.
Well, that's not right. She didn't prime the line first. What?
Samples.
Not Thomas Shelby. No. Now, I hate chain smoking. I also prefer a taller man, but for Cillian Murphy, I'd make an exception. So it's now nearly 3 o'clock. Realistically, hospital is just a lot of waiting around. She's in. It's in. It's seeping a little bit. What a lovely word. What a lovely imagery there. But it's in. It went fine. Bruce, absolute legend. Thank you for putting it in. Thank you for talking to me about Peaky Blinders. Thank you for talking to me about lots of crime documentaries. You're just the best. Having someone who's just so calm, so collected, and he always explains exactly what he's doing, which is so appreciated, because some physicians just don't. They just do things and you're like, oh, cool, didn't know you were going to do that to me, but thanks. So the PICC is in. Apologies, I just love this filter. It's so cute. So cute. It's in. And it's so weird. Like, I'm on such a high right now, because when you have like, or this is how I feel anyway, when I have any procedure done where I'm not having like an injection or needles or something, not nice, you just sort of have to like take yourself away from your body, and it's really weird because obviously you don't want it to happen, but you just have to like sit there and be like, okay, I'm just gonna trust this stranger doing things to me. So then after, when it's done, such a relief. So I'm just on an emotional high right now, and I can't wait to have my dinner and come home. I'm just so relieved it's in and it's done, and it didn't hurt anywhere near as much as I thought it would, thank goodness. The only thing that's left to do is to give my first proper IV dose, make it up myself, show the nurses that I can make it up myself so that they know that I'm capable, and then home time. Woo! It is now 6 o'clock. I've been told that I'm a free woman at 6:30. I've been here since 1. Oh, what a day, what a day. But I have some fun little goodies to take home with me. My bag of prescriptions, a new pet mask, because mine was quite frankly grubby and disgusting. Don't think I'm gonna have time to hit the shops, because they'll all be closed, which is pretty sad, but we'll save that for another day. Realistically, this has just been me filming lots of my face today and being like, this has happened, and you can just see my face and nothing else.
There are people there for you, whether you're aware of it or not. It's a really hard time for you, I promise you. It takes time and a little bit of effort. I know you won't believe me at first, but you just have to have a little bit of faith and a little bit of...
Oh my goodness, I'm so tired. Oh my goodness. So I got home about 9:20. It's nearly 10. I'm so tired. My mum asked me in the car like, oh, you must be shattered. And I was like, no, I actually feel fine. And I've stopped. I'm like, IVs. Oh my god, they're strong drugs. Only a few hours after my first dose. God, I feel wiped out. I feel like being in hospital is the equivalent of when you've been doing like customer service all day. if you work in retail or anything like that, where you have to, you know, smile and it's lots of thanks and all of the people looking after me today were really, really lovely, but it's still draining. It's still draining just being in hospital, and especially after not being around people for so long, it just makes it even more draining. So I'm so excited to go to bed and then wake up at 7:30 for the next dose of IVs. Rock and roll. Hello, I thought I would interrupt quickly to explain this a bit better. So IVs can be done at home where you're giving them to yourself, or they can be done in hospital. Given the choice, I will always choose to have them done at home. I just much prefer being in the comfort of my own home. I find it far less stressful, and I like just being able to do everything the way I want to. But some people will prefer to have it done in hospital because home IVs is a lot of effort, it's a lot of planning, and especially if you're really ill, maybe you just don't want to do them at home, maybe you just rather have them done by someone else, and I completely understand that. Also, depending on how sick you are, your CF team might say to you, we want you in hospital so we can monitor you properly, so you might not get a choice, but if you do, I personally will always opt for home IVs. I was hoping to do some proper like IV content where I talked about routine, like how you make up your meds, all that kind of stuff. But as you'll see in the second part of this video, not everything went to plan, so I didn't get a chance to do that, so I'll explain now very quickly. But just a bog standard IV routine will be that you'll have one main antibiotic 3 times a day, and you have to make sure that you space them out appropriately. For example, having one at 6 in the morning, one at 2 in the afternoon, and then one at 10 o'clock at night, but you've just got to make sure that they're not right on top of each other. And then you might be on another antibiotic, which could be 3 times a day, spaced out like as I just explained it, or just once a day, really depends what you're on. But as you can imagine, it does take quite a lot of effort and motivation to make sure that you're getting up early and doing everything properly and making up all the medication right. So it explains why a lot of people are like, I'll just go into hospital. Ain't no rest for the wicked. Oh, I woke up this morning. I was so like dizzy and uncoordinated that I nearly fell over a few times. I have and still have a very numb tongue and mouth, which shouldn't be happening. If you're getting numbness or tingling or anything like that when you're on IVs, it's not a good sign, not a good sign. A bit worried. I'm waiting for the doctor to call me back. Oh dear. Hello, it's been a few days, I'm pretty sure, since I filmed or done anything, because for the past few days I haven't been doing much other than just lying in bed and feeling a bit crap. But I'm feeling okay today, so I thought I'd kind of explain. I suspected that one of my IVs, the clindamycin, was giving me a reaction, and surprise, it was. It was giving me really numb and tingly mouth and tongue, but it was really concerning me because I couldn't feel like what I was doing, so it felt really strange speaking and also eating, and obviously I was a bit nervous not being able to feel my mouth and eating because I thought, what if I choke? So it's a bit scary, and it took like 24 hours to like flush out my system properly, and then I felt fine. Good morning everybody. I look probably vastly different from the last time I filmed because I'm just so random and cool and quirky. I just decided to chop all my hair off. But anyway, that's besides the point. Today I'm going back up to London to swap over to my other antibiotic, the tobramycin. It should be pretty stress-free, fingers crossed, but I feel like merely saying that I've now jinxed myself and it will be really stressful. I mean, hopefully this kind of illustrates how much of a faff like CF can be in general sometimes, because my hospital, like my hospital team is in London, and whenever they need anything or want to see me, I have to drop everything and go up there, and that's just kind of how that works, which it can be a real problem for some people. Obviously you kind of have to put your life on hold. There's always a lot to think about. Oh hello, oh my goodness, my hand's so shaky. Let's sit you down there. I think this is probably like the first time I filmed in the hospital. I'm currently hooked up to the tobramycin. So yeah, I think I feel fine so far. I just feel very light. But fingers crossed, no reaction, because honestly, if I have a reaction to it at this point, just like, I don't know, give me water IVs instead so that I just don't have side effects. Got some hospital bling too, check these. List of everything I'm allergic to on the red, my hospital number on the white. Oh my goodness me. So I'm finally allowed to go home. I had a reaction to the tobramycin antibiotic. Oh dear, oh dear, oh dear. I don't know what my body's playing at. But it was really scary because nurses and doctors kept coming in to check that I wasn't like having an allergic reaction, and I didn't. And I've had an antihistamine, and the symptoms are starting to go away, and I'm allowed to go home now. But I'm a little bit worried because obviously I have to travel for like the next 2.5 hours. But hopefully this at least kind of like shows how complex illness is literally all the time. It's never simple. Stuff like this happens on the regular, and I wanted to go shopping. Oh my goodness, I keep forgetting to vlog, and it's because, one, I'm embarrassed, but there's no one on this bit of street, so it's fine, I'll do it. But basically, it's 7:30, I've finally been let free. Makeup is, quite frankly, dry. When I get stressed, I just break out. It's awful. Look at this bad boy. I had a reaction to tobramycin. What are the chances of that, hey? I got really embarrassed there with people. But yeah, basically, walking to the tube station now. I feel fine. The cetirezine's kicking in. Bye. Right, so it has been an interesting day. After yesterday's kerfuffle, I had a doctor ring me who I've had trouble with before. Basically, pass off all my reaction symptoms as anxiety. Classic, we love that. And because of all the reactions I've had, and because my lung function is good, they think I should stop IVs, which to start with I was really not keen on, and I wanted to do the full 2 weeks. I wish I could finish this course, to be honest, but like, I just don't want to. I just don't. I'm just so sick of feeling dizzy and like I'm gonna fall over. I just don't want to. I just want to feel okay. Oh God, I've been such a moaning Minnie in this video, haven't I? It's just so frustrating when treatments don't go the way that you'd expected, and I hate as well feeling like I've wasted hospital time and resources and medication that could have been used for somebody else. Putting a PICC line in is really intricate and takes a lot of effort, so the fact that it was supposed to be in for 2 weeks and was only in for 6 days is really annoying, but obviously it can't be helped. I just was feeling a little bit sorry for myself in this vlog, but I'm fine, I'm fairly healthy, that's the most important thing, and there are far worse things that could have happened than having an allergic reaction. I think I was just very lucky that as a child I never really had these kind of issues. It wasn't until my teen years that I started to have side effects and reactions to things, but some people have always had this trouble, so I'm lucky that I've only just started experiencing that side of things now. As I'm sure you will have gathered, I decided in the end to take my doctor's advice and stop my course of IVs, and this meant that my PICC line needed to come out. So usually a PICC line would be taken out in hospital, but because it's never really bothered me just doing it myself, and because my mum's a nurse, and because we didn't want to take the whole day just for me to travel up to London for like a 5-minute appointment, I just said, can I do it myself? Can I do it at home? And they were like, yeah, sure. So that's what I usually do. I usually just take my PICC out myself, and that is going to be what this last part of the video is about. It's not that gross, but if you are squeamish, I just stop watching now. Eve, if you're watching, just stop now, lovey. So to start with, I have washed my hands, I have cleaned the surface adequately. We're now gonna take the old bandage off. Right, well I've zoomed you in a bit. Here is PICC. I'm just gonna be ouch. Now comes the funky bit where I have to very slowly pull it out. I was not ready for the end. Well, that went okay. So here's the crazy bit. This was all in me, round to the vein above my heart. Isn't that mad? Look at this bad boy. The wonders of medicine. I just find it fascinating, and the amount of time and effort it took to put that in the right place, and using ultrasound and like all these different tools and needles to get that in my arm in the perfect place for it to last. And then it took me like less than 5 minutes to take it out. Crazy. And that was the last clip I filmed. I really hope you enjoyed today's video. It was a bit of a higgledy-piggledy of clips as usual, but I really hope you've learned some things about IV antibiotics, what it's like to be on them, and also the complications that can come along with it. I'll see you in the next one. Bye guys, have a good week.